No, I'm saying how nice you are.
Okay, welcome to Labor and Health. Labor and Health will come to order on this fine morning, Friday morning, I might add. Welcome. We're going to start off this morning by hearing visitation rights. Senator McEwen, come on up and have a seat. Everybody please turn on their phones. When your phone goes off, we'll schedule you for donuts for Monday. Monday's a good day for donuts, I think. We need coffee. Maybe we'll add coffee to it if your phone goes off this time. Senator McEwen is going to present to us visitation rights, Senate File 80. Lead us off, Senator McEwen.
Thank you, Mr. Chairman. Members of the Health and Labor Committee, good morning. This is really a pretty simple bill. Basically, as we went through the COVID era stuff and some of the things that happened there, it ended up with some less than desirable situations. Take you back to, I think we all remember Representative Roy Edwards. He contracted COVID, kind of stayed at his house for a while, and they got him to the hospital in Gillette. They determined that he had COVID and that it was fairly advanced, so they moved him to Casper. In the process, they quarantined his wife to her house, so his children went down to Casper and never got to see him. And he ended up, as we all know, he passed away. So it was kind of a sad situation. And it was, I think the health organizations were trying to do the right things, but I'm not sure they quite got there. And that's the genesis for bringing this bill. And it's a pretty simple bill. It just requires that there is visitation. However, it allows the hospital the freedom of determining when and any of the requirements, masks, full gear, whatever it takes. But they need to post the hours and they need to post the rules. They can limit the number of visitors and the type of visitors. They just can't end visitation. And it pretty much falls in line for everyone except anybody who is a convicted criminal, felon, or somebody who's in custody will not receive the same rights. And that's pretty much what this little bill does. And I'll stand for any questions.
Questions for Senator McEwen, committee? Seeing none, stand by. We may come up with some yet. Any agencies that wish to comment to the bill? Department of Health? Welcome, Director.
Good morning, Mr. Chairman, members of the committee. Stefan Johansson with the Department of Health. I'm joined by Laura Hudspeth, who is the administrator of our state survey agency, who works with facilities, healthcare providers to enforce both state and federal requirements on the healthcare licensing and survey side. Mostly here, Mr. Chairman, is a resource to the committee. I did want to point out to the committee again that my department does have a role in enforcing conditions of participation, and we've talked about this before with various committees. So it really is the State Department of Health that, again, both on the state side and the federal side, has an enforcement role with what we call conditions of participation with Medicaid and Medicare. As Senator McEwen mentioned, which I totally agree with, the past several years have been incredibly difficult with some of the measures that were put in place. Overseeing 5 direct care facilities myself, several of which were subject to those same requirements at the federal level, it was terrible. And trying to strike the balance between what was clinically appropriate, what was safe, with imperfect information and knowledge, it was a very difficult time, and I think we all experienced it. We had patients and residents in our facilities, their families, and you all did too, that were impacted by this. So I greatly appreciate this bill being drafted. I know it's been discussed in different iterations, and I'll mention that from the health department's perspective, how we read the bill here is that it's a positive direction to articulate, I think, what the concerns have been, that we always want to encourage and require visitation of loved ones in facilities, especially safety net facilities and folks that are in really vulnerable positions or situations in their life to have visitation. I'm glad to say that is currently the federal perspective too. I know it hasn't always been in recent past, and I think some of the concern is it might not always be in the future. That currently visitation is required at these facilities with limitations. So we don't see on the macro side major issues with this bill, other than what I'll frustrate the committee with is, of course, hypotheticals in the future that should there be a situation that is different than COVID or a new type of infectious disease or something, that visitation at the federal level would be required for those participating in Medicare or Medicaid to be restricted, there could be a conflict. But I don't want you to hear hyperbole from me, because again, that's a hypothetical in the future. And I think the spirit of this bill to ensure that folks' families and loved ones have visitation and visitation rights is absolutely in line with what the Department of Health wants as well. Secondly, Mr. Chairman, I would mention, and happy to work with the sponsor or this committee, don't have the exact language today because it's a little nuanced. There are situations that are not on the infectious disease side when, we're talking a lot about infection control here, and some of the reasons for the visitation restrictions in the past were related to infection control. What isn't, at least from my naive perspective, articulated as well in the bill is when there's sort of clinically necessary or legal reasons to restrict visitation that really don't have anything to do with, an illness or something of that nature. Potentially a violent visitor where visitation would need to be restricted. Again, I'm not saying there's any intent to allow that in this bill, but we'd be happy to work again with the sponsor or the committee to maybe look at some language that would clarify that when there are clinically necessary or legal reasons to restrict visitation. But again, I offer that more as a concept and a discussion point for again, to work with anybody who would be interested to maybe suggest some language there. I just don't have it for you this morning. With that, Mr. Chairman, Ms. Hudspeth and I are happy to stand for any questions.
Questions, committee? When you mentioned that, the concept comes to mind of the gang member who was assaulted, who was shot, whatever, is in the hospital, who's not a threat himself, but there's a threat of someone coming in and trying to maybe do the job or finish the job or whatever that might be.
And Mr. Chairman, if I may, I think part of that accommodation would be similar to what's in the bill for detainees in Title 25, corrections, et cetera. I think maybe just for lack of a better term, some sort of legal or clinical catch-all there might benefit the bill, but again, would be happy to work with whomever on suggesting some language there.
Very good. Senator Barlow.
Thank you, Mr. Chairman. So you brought up Title 25, which is excluded from the visitation rights in this bill. There's probably, 3 facilities in the state of Wyoming, healthcare facilities that would routinely have 109, 110. This does not include Title 7 folks that you would also have in your facility at Evanston. So I guess my question was, I look at this, it seems like an equal protection issue that I would strike this if I would not have this in there, because those folks have rights as well. This does not seem, but you have a facility that would have those 2 types and other types that would be there for the same type of services. So does that create a challenge for you in operating the state hospital, just practically? Thank you, Mr. Chairman. Potentially.
Director.
Mr. Chairman, Representative Barlow, practically as it's written now and as I read the bill, I don't think so, because I think we would still retain the ability in the state hospital to restrict visitation, but and obviously exempted in this bill. In terms of, we obviously have to, on the other side of the coin, ensure civil rights of those individuals too, and we do that through visitation, whether it's in person or video or telephone calls, et cetera. I do think, again, that's the section that we would be happy to flesh out a little bit on what the appropriate balance is, especially on the legal side. Title VII, I think in many ways we do consider that a correctional detention. Those are pretrial detainees. in many cases, or folks who have been convicted of a crime but adjudicated not guilty by reason of mental illness. So again, I think it's captured here, but could use some tweaks to make sure we're on both sides of that issue, not overly restrictive, but also permitting civil rights, especially on Title 25, where folks have not committed a crime.
Senator Dockstader.
Thank you, Mr. Chairman. Director, we don't see, I'm just reading on page 2 along the second paragraph, you don't see a clash then with the Medicaid, Medicare requirements or anything like that? Go ahead.
Mr. Chairman, Senator Dockstader, again, not currently. It's tough, and I think everybody, I think the sponsor of this bill might agree, and I think we've all had these discussions. We don't know what the future holds in terms of what federal Medicare or Medicaid rules would be based on any sort of current situation, an outbreak, a legal situation, et cetera. But currently, under current guidance, my reading of this bill, current rules on the CMS side and guidance, my reading of this bill is that we wouldn't be creating a conflict. It really is more on the hypothetical side going forward that could need to be addressed if there were visitation restrictions that were imposed from the federal government.
Thank you. Further questions, committee? Seeing none, thank you. Anyone else in the audience who wishes to discuss Senate File 80? Come on up. Go ahead, sir.
Thank you, Chairman Baldwin, committee members. Eric Bully with Wyoming Hospital Association and Leading Age Wyoming. And obviously this is an important topic for us. And I appreciate the bringer of the bill, Senator McEwen. We've had some conversations about this. We were actually working on trying to come up with a solution at the end of the session last year. And we've had our legal counsel take a look at this. In today's environment, we really don't have any issues with this bill. Obviously, as Director Johansson described, there were many issues when it came to COVID. I think the thing that I would say is that we realize how important visitation is in our hospitals and our nursing homes, and we've always encouraged that. COVID created a situation that none of us ever expected, and I think we learned a great deal during that time. One thought I have is, this is basically what we're already doing. I sometimes wonder if it's necessary to have this bill to codify what is already taking place within our hospitals and our nursing homes, with the thought that we don't know what's going to happen in the future. We, as an association, worked with the Department of Health with License and Survey and tried to do everything we could during the pandemic to allow people to visit their loved ones. And I don't think we ever got it right. I don't think it was ever perfect. I remember countless conversations with CMS themselves pushing back from our perspective to try and ease some of the restrictions. And I don't know if in the future, if this would supersede federal rule and regulation. But I think if we could get some clarity to some of the questions that Director Johansson asked, because I can think of situations where we do need to restrict visitation for the safety of some of the residents or the patients that we're treating. I also represent Wyoming Behavioral Institute, where visitation sometimes really needs to be restricted for a lot of different reasons within their facility. And I don't think this bill addresses all of those, but I think in general, we could support this bill. Just not sure if it's necessary. With that, I'd stand for any questions.
Questions for Mr. Boley, committee? Seeing none. Thank you.
Thanks.
Anyone else here in the audience? If there's anyone else, go ahead and come on up and take one of the seats. Welcome to Labor and Health.
Good morning, Mr. Chairman and the committee. Carolyn Passano with the Wyoming Healthcare Association. Glad to have the bill come forward. We had a lot of lessons during the last 3 years, and we probably have more to learn as we go forward. I have been told by an administrator that a client, a resident in one of the nursing homes, they felt had given up by not having visitation, and they felt that one can actually die from loneliness. And I think maybe that's a subject that we should explore, and I have looked and have seen some research on that issue. I guess the point that I would like to make most of all is that we would need to have construction money if there were a need. And I don't know where that's going to come from, but in the last stages of COVID, we did have construction enough to allow family to come in, and it did help a great deal. It isn't finished, and if we should have such an outbreak again, and of course we're warned now that there is a more deadly virus coming, we do need to have a way for loved ones to come, because when there's fear and illness all around you, it makes a difference. And I would tell you that I saw in various nursing homes staff leave. It was difficult. And at this point, I can tell you that half of the administrators in our organization of the nursing homes across the state have moved on. Very difficult situation for everyone involved, residents and staff alike. Thank you.
Thank you. Questions, Senator Dockstader?
When, Ms. Pascal, when you say they moved on, they've left the healthcare industry altogether, or what are you saying?
They have left their position as an administrator or as a nurse or as a CNA.
They're just, Mr. Chairman, they're just no longer in the healthcare industry? They're not a part of it anymore?
Some of them have moved into other professions, the CNAs especially. That's easy for them to move on to McDonald's or some other position that paid the same amount. I do not know where some of the others have gone.
Thank you.
Further questions for Ms. Passano? Thank you very much, ma'am. Appreciate you coming to visit with us today. Go ahead.
Good morning, Mr. Chairman and members of the committee. I am Mara McManaman.
Speak real close to the mic there so we can hear you. Go ahead.
Yes, Mr. Chairman. Good morning, Mr. Chairman and members of the committee. I am Mara McManaman, fourth generation Wyomingite from Goshen County in Torrington, Wyoming. I am a 100% disabled Army veteran, but I am lucky enough to be able to care for my grandmother, Samantha McManaman, who will be 92 on February 18th. I would be completely devastated if I was unable to visit her if she became hospitalized. I think this is a good bill, and I would urge you all to vote aye. Thank you for your careful consideration, and I stand for questions.
Thank you. Any questions, committee? Seeing none, thank you very much for coming and visiting.
Yes, thank you all for your time.
Thank you. Sir, go ahead.
Good morning, Chairman Baldwin and Senate committee members. My name is Steve Milia from here in Cheyenne. I agree with Senator McEwen on this and all previous proponents of this bill. I support it, and other than agreeing with all they've said, I have nothing else to say other than please pass this bill.
Very good. Questions, committee? Thank you very much for traveling that long distance. Really appreciate it. Anyone else here who wished to comment to the bill before we Go, Ty. I believe we have one online person.
Mr. Chairman, we have a number of people online.
I've only
Anyone that
got,
wants to testify would raise their hand.
I believe Mark Moody, is that? Let's go ahead and get him in and.
Mr. Moody just needs to unmute.
There we see. Go ahead, sir.
Hi, good morning, Mr. Chair, members of the committee. Mark Moody from Cheyenne, Wyoming, and I fully support this bill 100%, and I'll stand for questions.
That was the short testimony of the day. Thank you. Questions, committee? Seeing none, thank you very much for coming and visiting with us, even if briefly. Okay, is there any further testimony online for 80? I don't believe so. Anyone else in the audience? If not, let's close this to public testimony. Committee, what's your pleasure? Bill's moved. We'll give Senator Bouchard that one. We'll give a second to Senator Dockstader. Okay, let's work through the bill real quick. Anything on page 1, committee, that you see? Page 2. Page 3. Page 20. No comments. Question on the bill. And I'd let everyone know Senator Barlow had another meeting he had to go testify at, so he did leave a proxy vote on this. Go ahead.
Thank you, Mr. Chairman. Senate File 80, Visitation Rights, Senator Barlow,
He was an aye.
Senator Bouchard,
Aye.
Senator Dockstader,
Aye.
Senator Hutchings, and Chairman.
Aye.
We have 5 ayes.
Senate File 80, Visitation Rights, has passed the Labor and Health Committee of the Senate. And I say you may want to get with the director if there's any suggestions on any language. Thank you very much for coming in. We appreciate seeing your face on our committee again. Okay. The next bill for our consideration is Senator Case. And I've seen him stick his face in the door a couple times. Senator McEwen, when you go out, can you look in the room next door and tell Senator Case we're ready for him? The next bill is going to be EMS District, sponsored by Senator Case and Representative Lloyd Larson. I've seen Senator Case's face in that window and that window, so I know he's not far away. He had a meeting next door and one across the hall. There he is now, the distinguished senator from Fremont County. Come on down. Welcome, Senator Case.
Thank you very much, sir.
You're a busy man this morning. We appreciate you taking time.
I've been up those stairs in the appropriations room 3 times. Oh, Lord.
Do you have a
Keel over, I hope there's a doctor.
do you have a step counter on?
Catch his breath.
Yeah.
Thank you very much, Mr. Chairman. It's good to be here with all of you, and I bring to you Senate File 43. It's a bill that allows for county commissioners to form an emergency medical services district. It basically takes an existing procedure for establishing a district, which is where it's the petition basis, where, and it takes that and carves out an ability for the county commissioners to establish this district. And so as a bit of a model, that's the way solid waste disposal districts are done. The county commissioners appoint the board members, they establish the district. But the mill levy, and this is an important piece, what the bill does is make sure that any mill levy that they wish to impose has to be approved by the board of the district, by the county commissioners, and submitted to the people for a vote. So the county can appoint a district board, they can set the district boundaries, but they can't impose a mill levy and without a vote of the people. And just talk to you a little bit about the challenges of providing emergency management services in rural areas. I suspect I'm looking at some people that realize those challenges right now. But in Fremont County, it's vast, it's underfunded. We're searching for resources to maintain EMS services as we go forward. And I know that I'm speaking to folks with more experience than I have in EMS services, but the trend has been to have more certified EMSs, and it's gone from a volunteer to a professional arrangement. That's what the public demands. Public demands pretty fast response times. In a place like Fremont County, that's pretty difficult to achieve. And so, you know, we have situations where an ambulance is needed in Du Bois, but it's just been dispatched on the other side of the county. And there's more than one ambulance, don't get me wrong, but they can get tied up pretty fast. So it's sort of like we need more, bigger, better. We don't know how to fund it. One proposal is to allow counties to form districts. So obviously it's up to each county. And I'm not suggesting this fits every county, but it does allow for the possibility of getting up to 4 mills and property tax for provision of EMS services. So with that, I'll give you an overview of the bill. So, Mr. Chairman, it goes into these are county statutes. Title 18 is the counties. 812-105 has to do with making a district. And what we've done is carve out an alternative way to do this, which involves the county commissioners making the appointments. So that's all you'll see new language, and then you'll kind of see conforming language. Like on paragraph 2, paragraph A, that used to be just a single paragraph, which was about filing a petition to form a district. Well, this district is different, so we allow exception, and that's discussed in B. After July of this year, and as an alternative to forming a district under subsection A of this section, a district to provide EMS services may be established by resolution of the Board of County Commissioners. A resolution under this subsection shall establish one or more districts to provide EMS services composed of any portion of the county. Areas may be added or subtracted from an existing district by resolution of the Board of County Commissioners. Not less than 60 days before any resolution pursuant to this section is signed, the Board of County Commissioners shall submit the proposed boundaries of the district to the county assessor, the Department of Revenue for review of any conflict, overlap, gap, or other boundary issue. The assessor and the department may make written comments thereon to the Board of County Commissioners. The Board of County Commissioners may dissolve the district established under this section. So the next part, 1812-113, that tells about a district's board of directors. Once again, it's the same kind of structure where we carve out a different procedure for this district. So except for districts to provide EMS services established under WS 1812-105B as provided in subsection E of this section, and then it talks about what an improvement in service district can do. So that's where we have a lot of the exceptions to existing law that come in another place. So really the meat is on page 4, part E. After July 1st, 2023, if a district to provide emergency medical services is established under WS 1812-105B, the Board of County Commissioners shall appoint not less than 3 no more than 9 residents of the district to constitute the board of directors of the district. Appointees shall serve a term of 3 years and may be reappointed. Terms of office shall be staggered. 1812-119 deals with the tax levy, Mr. Chairman. And so once again, it's the same structure, saying if the county commissioners form the district, here's what applies to them. And so that's down on line 16 through 19. It says if the district were formed under WS 1812-105A and is providing emergency medical services under WS 1812-112A, and that's EMT services, Mr. Chairman, the tax for the district shall not exceed in any 1 year the amount of 2 mills on each dollar of assessed valuation of the property unless an additional 2 mills is approved by the board of directors. So they can go up to 4 is what that really says. If the district were formed under WS 1812-105B as a district to provide EMS services, the tax for the district shall not exceed 4 mills if the mills are approved by the board of directors and approved by the electors as provided in subsection C. Subsection C talks about the election to be held. And if the board of directors votes to impose mills that require approval by the electors under subsection B of this section, the Board of County Commissioners shall call an election within the district upon the question of whether the mill levy should be imposed. And then there's rules about doing the election, Mr. Chairman. But the election shall be called, conducted, and canvassed as provided for bond elections by the political subdivision bond election law. On the first date authorized in WS 22-21-103, which is not less than 60 days after the board of directors votes to impose any mill that requires approval of the electors. And the rest, I think, are just conforming. So that's the bill, Mr. Chairman. Our county clerk has a couple of amendments she would propose. I've had a lot of experience with special districts, and this is sort of, we have special districts that elect their own board of directors and are essentially very separate from existing local governments. They don't really interact at all. The county has no authority over their budgets or anything like that. This one is different, following the model of a solid waste district where the Board of County Commissioners actually appoints the district board. And so they have the ability to dissolve a district should they choose. They have more control over the budget. It's a little bit tighter arrangement to help it work in partnership with the county. So that's the bill. Ms. Freese wanted to have some publishing requirements from another statute to make sure that the thing is published. And she's got a couple of things on that. That's our clerk, Julie Freese. Happy to answer any questions if I can, Mr. Chairman.
Questions? Senator Dockstader.
Thank you, Mr. Chairman. Senator, appreciate you bringing the bill. It seems like this is similar to something we did about 8, 9, 10 years ago. We created something regarding medical services. I was going to go look it up and I didn't have a chance. What are you adding to it? Is it the county portion, their involvement?
Yeah, Mr. Chairman, basically this whole bill is to make it a tightly work in partnership with the county commissioners district.
Follow up?
Go ahead.
So as when we created that first one, we found some unexpected support. I brought the bill based on one of our communities saying we want to put an ambulance in a heated garage up and for quicker response. Since then, we have more organization with our hospital, and they raised the bar and got rid of some turf battles, and they put, I don't know what it's called, paramedic level in every community with quick response, much better than it ever has been before. How would this tie into your medical services there in Fremont County, Riverton? Isn't that a private hospital? How would all this tie in with their work?
Senator Case.
Mr. Chairman, right now we have standalone ambulance services. They're not provided by the hospitals. Currently, we have one private company that has hospitals in both Lander and Riverton. Riverton is building more of a public hospital. It's a nonprofit that'll operate in conjunction with a hospital in Billings. But I don't think there are plans for EMS services. So we've always had kind of standalone EMS services. Of course, several years ago, it was just volunteers, EMT training at best, probably. And so now people are kind of demanding a more professional level of services, certified paramedics, the ability to do more things in transport and on the field. And so we have a hard time servicing the whole county. As
Big county.
I think you can imagine, our population is 40,000, but it's spread from Du Bois to Atlantic City, probably be 95 miles, that's a haul. And you got Jeffrey City. I mean, it's really spread out. We have a lot of industry that, remote oil fields and things like that. So you could have 3 ambulances strategically placed with crews in Fremont County and still suffer a situation where a need for a 4th one in a different place comes up. It happens almost every day. The county commissioners have been able to fund this, but the budget constraints are increasing. People want a better level of service than we're getting. And the commissioners and Commissioner Mike Jones, he helped to draft this along with my co-sponsor, Representative Larson, and a former county official named Scott Harnsberger. Kind of all of us got together on it. I think the commissioner supported it. I think Commissioner Jones is here to online to testify.
Thank you, Senator Gates. And I would add that there's some nuance to this too. The reimbursement among EMS is very poor.
Yeah.
And a large percentage of what these ambulances go on are things like, can you help me get back in my chair? Help, I fall and I can't get up, and there's no reimbursement at all. So just another nuance to this whole thing.
And Mr. Chairman, you're exactly right. And the abuses kind of follow through our 911 system. And we need a better way of capturing non-emergency things throughout our entire system and rendering assistance. There's a lot of this that is transport between hospitals. Frankly, in Fremont County, one of our things we talk about is if it's serious at all, very likely you will be transported out of the county. Casper might be a choice, but it might be Salt Lake, it could be Denver, it could be Billings. We have more flights than anybody. And it's, we don't have a hospital like you have in Cheyenne. So, and frequently, and this is really sad too, that you can be taken to the hospital and and you can have something wrong with you that's not serious enough to necessarily be transported, but because the hospital is short of nursing staff or other staff for coverage, they can't take you. So you get life flighted. And these bills for life flight are just insane. This isn't going to fix that. This isn't about paying for people's flights, but it's all wrapped up. There's user fees, but we have a very poor populace in Fremont County. And lots of times user fees don't get collected. I imagine you both know some of this, but it is a very difficult business at best.
You had a question, Senator Hutchins?
Yes, I do. Thank you, Mr. Chair, and thank you, Senator Case, for bringing this to our attention. I was a firefighter EMT in Alaska, so I understand how things are spread out and getting from point A to point B and traveling 21 miles, doing CPR on someone just to get them to the hospital. My question is, how is this going to affect the other counties? That's question number 1.
Senator Case.
Mr. Chairman, it would have no effect on a county per se. Each county could do this or choose not to do this. So it's not a model they have to adopt. It's a permissive, if they can make it work. If this is, now, I need to qualify slightly. I think it's important in some services that there be coordination between EMSs on different boundaries. And I don't see how, I want to make sure that we promote coordination of EMSs that are maybe funded in different matters. I don't think this creates a problem in that area. I know that they've worked out cooperation already. And that's really an important piece. Like above Du Bois, you can either be transported back to Riverton or Lander, or you can be transported to St. John's over in Jackson Hole. Well, St. John's is a better hospital, probably. It's got a higher rating. It may be closer, and it may be a better place for these people, these things to go. We want to make sure that because you're crossing a county boundary, that these services can cross county boundaries and take somebody there. So there'll be a lot of coordination.
Follow-up.
Yes, sir. Question number 2 was, let me see if I can find it on my list. What about those private ambulance companies? How are you guys going to interact with them? Your county is getting money to pay for the services, and then you have maybe, like you say, crossing into another county where there's a private company. How are they going to interact with one another?
Mr. Chairman, we have a private company now. That
Okay.
private company could stay and just be funded by the district. They could, in essence, be contracted for by the district. It's not necessary that this be publicly provided. This is really just providing a funding stream.
Further questions, committee? I think you're off the hook. And I know we got Mr. Jones online, and I know we have a couple of EMS directors online to testify. Is there anybody in the room or departments? Do we have any departments? Welcome, introduce yourself and go ahead and tell us what's on your mind.
Mr. Chairman, members of the committee, my name is Dirk Dykestel. I have my colleague Aaron Kaler, who's the Office of EMS Manager as well, and just wanted to come and clarify any questions you may have on this.
Any questions for these folks?
Mr. Chairman.
Go ahead, Senator
Clarification.
Dockstader.
What is the Office of EMS Manager? How do they fit in with all the services across the state?
Go ahead.
Mr. Chairman, Senator, we at the Office of EMS, we set all of the standards for regulations. We're the regulatory body of all the EMS services across the state.
Thank you.
And I know you probably don't have all the, maybe you got all these numbers in your head, but I'll just ask you anyway. And the question is this: how many basic EMS services, how many paramedic level EMS services, how many advanced EMT services, and then on top of that, how many volunteer services only versus aides, perhaps associated hospitals? Any of those numbers that are floating in your head?
Sure, we can get you much more in-depth information. I'm not quite the encyclopedia, Mr. Chairman. However, we do have, I believe, 43 transporting agencies in the state. Now, how they break down in the different levels that you asked for, I would need to get back to you on. However, just while we're talking about agencies, we have seen over the past 10 years, 9 EMS agencies that were consolidated into another, and then 10 that did close down.
Very good. And I would be interested, particularly I would be interested in volunteer services versus paid services. I think that's an important nuance of this whole thing. Senator Dockstader.
These places that closed down, do they have any service now?
Go ahead.
Mr. Chairman, Senator Dockstader. Yes, and I would say the overwhelming majority of those have either consolidated or have been assumed by another agency. There have been some areas of the state that have obviously much more frustrated service, but a majority of these areas are still receiving services from EMS providers.
Let me add to that nuance, just from our area. These gentlemen probably know that. We have services in the fringes of our county, LaBarge, Cokeville, who the EMTs come and go. Sometimes they have enough to run a service and sometimes they don't. And so what happens is the next closest service, in the case of LaBarge, it may be Big Piney that comes out of Sublette County that comes and helps. It may be somebody out of Kemmer that comes and helps. Or in Cokeville, it may be somebody from Star Valley. So, or perhaps even somebody from out of state. It may be a Montpelier ambulance. So, and those come and go. Right now, Cokeville has EMTs and they can run a service, but those shift. I mean, as people move in and out, particularly with the volunteer services, that changes a lot through time. So, any other questions, committee? None. Thank you very much for coming. And thank you for doing what you do. It's challenging right now, I know. Okay, anyone else here in the room who wishes to testify? If you do, come on up. We've got 4 chairs, so 4 of you come up. Or 3 or 2 or however many we got. Welcome back. Go ahead, sir.
Mr. Chairman, members of the committee, my name is Don Morris. I'm a former EMT, former school teacher years ago. And I am also a volunteer for the ARP Wyoming Government Relations Committee. And we're in favor of this bill. And I think the most important thing about this bill that I personally like as a former civics teacher is it gives people at the county level, the fundamental level, the opportunity to, if necessary, raise funds to deal with a problem at their level. And if there's a shortage of ambulance equipment or they need more training and they need to raise funds, this gives them the ability to, at the fundamental county level, or at the EMS district level, to say, yes, we either will or will not raise funds. And I can't think of anything more democratic than that. And I know that the state has had some EMS problems. I was fortunate enough back in the 70s to be an ambulance surveyor for the state of Wyoming. And we saw ambulances that had no equipment. As a matter of fact, towns that had no ambulances and no training, not even a first aid card, develop into fully equipped ambulances with fully trained EMTs. And so it's a bit distressing to find out now that, there are some areas that are hard pressed for service. So just getting back to the fundamental point of this bill, it seems like it gives people at the county level a chance to improve their service. And so we are in favor of the bill. And I'm open for any questions at this point.
Questions, committee from Mr. Morris? Seeing none, thank you. Mr. Boley, go ahead, sir.
Thank you, Mr. Chairman, committee members. Once again, Eric Boley with Wyoming Hospital Association. I also serve on the Governor's EMS Council. And for the last 2.5 years, I've served with you, Chairman Baldwin, on the Governor's Healthcare Task Force. EMS services is one of the topics that we've identified through that Governor's Task Force. And it's become a priority for him to try and find ways to stabilize EMS services around the state. I think this is a good tool in the toolbox. I'm not sure it's going to solve all of our problems. As some of you remember, a couple of years ago, 2 or 3 years ago, we passed a bill through this committee and then on through the legislature for an EMS upper payment limit or enhanced reimbursement program that we're still in the process of standing up. We've seen a lot of changes around the state in EMS services. We've seen consolidations. We have seen some services go out of business. There's actually some ARPA funding being awarded here shortly through the Department of Health to help with some of these pilot projects that are going on. And I think that you've already identified some of the issues that we're seeing. There's a higher level of training that's needed right now. Volunteerism is tanked, and Chairman Baldwin and I are very familiar with that, what happens over in Lincoln County. I'm glad to see what's happened up in North Lincoln County with the 3 services coming into the hospital. And we're seeing some good things take place up in the Bighorn Basin. We're seeing some good things taking place up on the I-90 corridor with Sheridan and Gillette partnering, and we're seeing good stuff happening in Sweetwater County. I think we need to stand in favor of this so that we have another tool, and I think it's great that it goes to the voters. obviously, we've been a proponent of other special districts over the years. And I think that if it can add any funding to stabilize these services and maybe help them bring in additional people, it would be great. The other thing we've seen, even just talking about equipment, we used to be able to go to the SLIB board and get funding to help buy new equipment, new ambulances. That funding has gone away now. And so even the replacement of aging ambulances is getting more and more difficult. When you look at a price tag of $350,000 for one, it's a big ask. And so I'd answer any questions, but we would ask you to advance this bill. Thank you.
Questions, committee? Seeing none, thank you very much. Mr. Obermuller, go ahead, sir.
Good morning, Mr. Chairman, Committee. Pete Obermuller, President of the Petroleum Association of Wyoming. So let me just say at the outset, Mr. Chairman, that we don't oppose this bill. It has more to do with the overarching concerns with the special district process. And I have great respect for Chairman Case, and in my previous job, when the Special District Task Force was created by the legislature, spent a long time together trying to work on that, and we took our fair share of arrows by asking special districts to be a little bit more accountable and transparent. There are over 700 of them, and they command billions in tax revenue pretty much every single year. So the trouble that we have is that because of our tax structure, and you all know this, while the commissioners can draw the boundaries the way they want and it goes to the voters, the only way to raise money in special districts is to draw the boundaries around the extractive industries, because our industries are the only ones that pay any appreciable property tax. So our general approach has been to oppose special districts. Now, this one we've had a lot of longer conversation about, because obviously we need these services to come out to our fields, and we're perfectly willing to pay for those if that happens. I want to ask the committee to think about how to solve this issue in Senator Case's district and other places that's just beyond capturing money from oil and gas industry. How does it interplay with private services? The types of bills that patients get, like Senator Case alluded to, those will not go away under this bill. People will just instead see in their tax bill 4 mils for EMS, and they'll get that bill. So we need to think about what is the EMS structure in Wyoming, and how can we solve this problem that's beyond just drawing these boundaries and adding 4 mils. My friends at the counties will not be pleased to hear me say that I think it should be an essential service. So, Mr. Chairman, again, I'm not opposed to the bill. I just asked the committee that perhaps we need to think more holistically about it moving forward.
Thank you. Questions, committee? I would just add to that, the task force that Mr. Boley mentioned, we got several things under consideration. Regionalization would be one of them. Essential services is another. Essential services sometimes cause, you can imagine the kind of controversy that causes, but there are several things under discussion. And I view this as probably one of the arrows in the quiver, if you will. Senator Case, go ahead.
Mr. Chairman, may I ask Mr. Obermuller a question? It's right on point. We did serve on a special districts task force together, and I became convinced out of that work on the special district that some districts are more accountable and transparent than others. And what I did come away with, the ones that are closer tied to the counties and county government are maybe a better vehicle for budget control and et cetera. And I was wondering if you might ask him to comment on that.
Mr. Obermuller, go ahead and make your comments on it.
Thank you, Mr. Chairman. I think the senator is exactly right about that. There are counties, there are special districts that have more requirements of transparency and accountability at the commissioner level, and appreciate the Senator Case wrote this one to be in that category.
And it serves my memory that, I don't know, a year or two, however long ago, we talked about you know, the overview and the audit of those special districts and change some of the requirements. So, okay, any further questions for Mr. Obermuller? Thank you very much. Anyone else here in the audience wishes to discuss this? If not, I'd like to bring Commissioner Jones in, if we could, please. And actually, if you want to invite Mr. Quinney and Mr. Luke Shepard in as well, we'll speak to them after Mr. Jones.
Good morning, Mr. Chairman. Can you hear me?
Is this Mr. Jones? Oh, there you are. Nope, that's Mr. Quinney. We're looking for Mr. Jones. Who's talking to us?
Yeah, this is Commissioner Jones, and I'm trying to start my video.
That's okay. Go ahead and speak. Oh,
There
there
we
you
go.
are. Go ahead.
Good morning, Mr. Chairman. Thank you for allowing me some time to speak. I do come on behalf of Fremont County Commission and the WSCCA this morning. Our director, Jeremiah Raymond, asked me to stand in. We did discuss this as a association last week and voted to be in favor and support of this bill. We certainly have struggled, and I won't rehash some of the ground that Senator Case, and thank you to him for bringing this forward. But we managed our own EMS district up until 2016. Due to the low reimbursement, we were subsidizing that to the tune of about $650,000 a year. We opted to go to a contract model, which we did with Guardian, and then which was bought out by AMR. They actually paid us for the first couple of years until they realized how much cost. Our intent was they would bundle that with their air flights, and it just didn't work out that way. So they came back in 2020 and said it's going to cost you $2 million, or at least $1.5 million. And so we went out to bid. We hired Priority Ambulance, which we call Frontier in our local county. The first year, our subsidy to them was $950,000. And this last year, 2022, excuse me, we are now paying $1.45 million as a subsidy. We do have volunteer EMTs out in Lysite and up in Du Bois, and they interact. Unfortunately, they do have to maintain their certifications and levels that we need to, and that can be difficult. I think that it's worth pointing out these volunteer models that do exist, and there's a lot of hybrids, and we have a little hybrid in Fremont County. These volunteers are paid per trip now, so it's not completely a volunteer model, and that's changed over the last 10 years as we've moved more and more to requiring a more professional model, and we require an advanced license with a paramedic, and that is getting more and more costly. As Fremont County Commissioners and the Commissioner Association, we like options. And this district, as spelled out in Senate File 43, is a good option for us. And it's not a mandate, and we're not even sure we can convince everybody that this is the right way to go. It gives the commissioners an option to go forward, put the ask out in front of the constituents. And we really, really like that. We like the accountability that's built into it, the streamlined nature of it. If you've looked at the rural health districts and the mental health model, those were pretty cumbersome to get out in front of the voters. And Senator Case has stayed tuned to our conversation, and we have worked with our local partners, our local mayors, the tribes. We've had many conversations over the last 2 years on how do we come up with a sustainable funding model. And of course, we've watched what's happening throughout the state, and it's happening elsewhere. Everybody's struggling with the same question. So we stand in support, and I'll stand for further questions. Thank you, Mr. Chairman.
Question for the Commissioner. Senator Dockstader.
Thank you. Thank you, Commissioner, for joining us. You mentioned you're not sure if the people would support it. What's the atmosphere? Do they see a need to improve their EMS services to the point that they would financially support a district?
Commissioner.
Yes, thank you, Mr. Chairman and Senator Dockstader. Thank you for that question. The not necessarily resistance, but as we've talked to the local mayors, we have a half-cent economic development tax here. We have a 1% infrastructure tax. Their concern has always been, boy, we're making a lot of asks, and it is, and we understand that. That it is. So that question of, boy, more taxes is probably the biggest concern. However, with this bill, I think it is just an ask. It is not necessarily, we're not going to ram it down anybody's throat. We're going, it gives us an opportunity to have one more arrow in our quiver to go out and put that ask. So that would be it. Thank you, Mr. Chairman.
Thank you.
Further questions for the commissioner? Senator Hutchings.
Thank you, Mr. Chair. Mr. Commissioner, as I listen to the group speak, one of the things that I know, voters don't always understand what they're voting for. As Mr. Obermuller stated, you're still going to pay the tax and still have the high bill. How are you going to market this to the people? Will they understand that? Or will they just see the vote yes on whatchamacallit signs across the city or the county? Thank you.
Commissioner Jones.
Yeah, Mr. Chairman, Senator Hutchings, thank you. Yes, that is the biggest challenge. My guess is we would hope that there would be a PAC formed. There is a lot of support for EMS. That we've been pretty candid about the challenges of funding EMS, and that conversation has been in the news for the last 2 years, especially with our conversations from County Association of Governments and with the tribes, and the topic is always the forefront. So my guess, if a PAC was formed, we could go out and that message could be built, and the need could be built. There is, at a fundamental level, our perception is that everybody wants to support EMS. They don't want it to go away, so that's a good start. I will say, somebody did mention the essential service. We, through the EMS task force, and our Commissioner Allen, who's now our chairman, was on that task force. There was some conversation with LSO, and fire is not an emergency, or is not a essential service either, and it would create issues legally for us to ask for that as an essential service. So we're kind of stuck with the paths that we have, and this gives us another path. Thank you, Mr. Chairman.
Further questions, committee? Seeing none, thank you for joining us, Commissioner Jones. We appreciate you being here. Anybody else online? I know we've got the two EMS folks.
Yeah, I admitted Mr. Quinney.
Mr. Quinney, Eric, we saw your face a few minutes ago there. I see the top of your head. Very nice haircut, by the way. Go ahead, Mr. Quinney.
Thank you, Mr. Chairman and committee members. My name is Eric Quinney. I come to you representing the Wyoming EMS Association and also the Chief Administrative Officer for Uintah County Fire and Ambulance here in Uintah County. Most people, the commissioner just said that fire was not an essential service, but fire protection is required by state law, that municipalities are required by law to provide fire protection. Nobody is required to provide EMS services. A county is not required to provide EMS service. A city is not required to provide EMS service. But when people call 911, they expect help to come. And here in Uintah County Fire and Ambulance is a joint powers board, and we operate over 2,000 EMS calls a year, based on with volunteers. We receive $0 in subsidy from our county or our municipalities here. And the only way that we're able to provide services is because we have 55 dedicated volunteers that are paid per call, but are willing to volunteer their time to be trained and to respond. And we respond to over 2,000 calls a year. About 1,100 of those, 1,200 of those are calls that we can bill out to patients. We have a high number of calls that we are able to bill out. We can spend the entire day running down I-80, going from wreck to wreck to wreck, checking on patients that have slid off on their cars and not transport a single person to the hospital. We don't receive any money from anybody from that. This EMS district's plan, as set forth by Senator Case, is another tool in the toolbox to support a system that, for me, is not long-term sustainable as we are right now. Volunteerism, as Mr. Boley had mentioned, is tanking across the nation. I represent Wyoming on the National Volunteer Fire Council. I am the chairman of the EMS section for the National Volunteer Fire Council. And volunteerism across the nation is plummeting. And this is not long-term sustainable. I don't have the ability to keep my doors open here in Uintah County long-term without alternative funding sources. The cost of doing business is not being reimbursed appropriately by the federal government from Medicare and through Medicaid. And those problems are problematic for us. So as the Wyoming EMS Association, we support another tool in the toolbox, but we also need to have a more holistic approach to fixing EMS in Wyoming, because the state of affairs are troublesome. And if we don't do something to help sustain us, more and more services are going to close the door, and people are going to wait longer times for ambulances to come. And waiting longer times when you're having chest pain or you're not breathing is problematic. And like I said earlier, I could spend the entire day on I-80 helping people and not being able to bill them. And those people don't pay any taxes in my county, and they wouldn't pay any taxes through this plan. And so there's got to be other ways out there, but this is a good tool in the toolbox to start giving counties that need those tools. Some counties aren't going to need it, but some do. And this is a good start. And the Wyoming EMS Association is in support of this start, but certainly in support of a larger approach to fixing EMS in Wyoming as well. Thank you.
Questions for Mr. Quinney? Seeing none, thank you very much, Eric, for coming and visiting with us. And we'll be on your stretch of I-80 here shortly, we hope, or maybe not if they don't open it. Okay, do we have Mr. Chaperone?
Yes,
Luke?
we do.
Luke, if you can hear me, let's go ahead and we'll take your testimony. Go ahead, sir.
Good morning, Mr. Chairman and members of the committee. My name is Luke Seifert. I am the president of the Wyoming EMS Association. And as my employment, I work as a paramedic and a supervisor. So I hope as we discuss here, you'll ask questions and I'll do my best to answer them. But to start, I would like the committee to know that the Wyoming EMS Association is in favor of this bill, as has been eloquently stated by Mr. Quinney and Mr. Boley. We don't believe that this is the end-all be-all for stabilizing EMS, but the efforts through the Wyoming EMS Association, the Hospital Association, the Governor's Health Task Force are pushing for a much broader approach to stabilizing and revamping our system. We know that there needs to be a system redesign, and so we're pleased with the legislature and the governor's efforts to support pilot projects, and we believe that those will deliver fruits that are worthy of further exploration. We are working with CMS, both as Mr. Boley mentioned, through the UPL bill, and we're working directly with CMS on Medicare issues. The federal government is re-examining the reimbursement rate for ambulance services and the services they provide, but again, as we all know, that will take many, many years to provide any fruits. And so I think that the mill levy is an appropriate, perhaps short-term answer. Mr. Quinney mentioned that we have a lot of users who don't reside in our counties, who will not pay property taxes to use those services. We get those through tourism, we get those through just pass-through traffic, and those can often be our most expensive calls, both for fire and for EMS due to the resource allocation. But we are very pleased to see that the legislature has heard our voice and heard the needs of EMS and is working towards solutions. So again, we do support this bill, and I thank you for your time. Stand for any questions.
Questions for Mr. Seifert? I don't see any questions, Luke. Thank you very much for visiting with us today.
Thank you, Mr. Chairman.
Stay
Thank you,
safe
members.
there.
Thank you.
Anybody else online testify? I don't believe so.
Yeah, Mr. Chairman, we have a number of people online, but so far, no hands up.
I think they're here for something else. Okay, without further testimony, let's close this to public testimony. Committee, what's your pleasure? Oh, wait 1 second. Before I do that, we have a county clerk who has some amendments for us. Hopefully we have a county clerk. Not online?
Yeah, I don't see Julie Freeze online.
Okay. No one here has those? Those may have to be committee of the whole amendments, perhaps. Okay.
Mr. Chairman,
Go ahead.
there's a
Oh.
document that was just provided to you.
Oh. Oh, there we go. Okay, we have them. Okay, committee, what's your pleasure? Bill's moved by Senator Dockstader.
Yeah, I'll move it. We need a second, though.
Second? Anybody second the bill? Moving the bill? I'll second moving the bill.
Okay. So, Mr. Chairman, and I can recall we put something like this in a lot of years ago, maybe 8 years ago. The good senator says that he refined it, fair enough. I'm not a big fan of adding more districts, but each county has a different situation. And they may find when they take this out to the public that they're not as enthused as for an additional fee to do this. But nonetheless, let's move it out of the committee to the floor for consideration. And I'll insert those amendments as requested by the county clerk at that time when you go through it.
Very good. Further discussion, committee, or suggestions, ideas? And I, like you, I think this is one of those things that puts this out to decision of the individual counties, and that not necessarily everybody's going to do it. Perhaps a minority will do it, but it's a tool they can use if the population, the citizens decides it's something they want to use, because it's a crisis that we're facing. Matter of fact, committee, I would throw out the reminder now as we go to interim topics of volunteerism, specifically fire and EMS is one of those things I'd like to look at in the interim. With that in mind, let's go through the bill real quick and add amendments as we will. Anything for anybody online on page 1? Page 2.
Mr. Chairman?
Go ahead, sir.
Move page 2, line 22, as requested by the clerk. After county commission shall insert, publish in a newspaper general circulation in the county's website. On the county's website, the proposed resolution, including the date and time of the public hearing. County commissioners shall also. That's on page 2, line 22, Mr. Chairman.
Very good. Committee, any discussion on that amendment? Seeing none, question on the amendment. Oh, go ahead, Senator Bouchard.
Mr. Chairman, I wonder if we can do something friendly to this section of the bill here, maybe even in this amendment, but does it specify anywhere in this bill what time of the election cycles, or like during a general election?
I believe the only thing that's specified is not less than 60 days after the county commissioners make a decision to form the district. Go ahead, Senator Dockstader.
Mr. Chairman, that's correct. I'm a little hesitant to change much more without the sponsor here.
Okay, so we have a motion on the floor. All in favor of Senator Dockstader's motion? Oh, go ahead.
I'm gonna be in, and I don't know if Senator Bouchard wants to propose an additional amendment here or somewhere else in the bill, where he did mention when that notification is gonna happen. I think it's important because people during a general election may just check a box, where if it's not during the general election, they'll have to think a little bit more about it. So I don't know if you wanted to
Correct.
elaborate on your question?
My suggestion here is that we work the amendments we have in hand.
Okay,
And
and
if we
then
do
move on.
that, then we'll do that as a separate amendment.
Gotcha, thank you.
So with that in mind, all in favor of Senator Dockstader's motion for the amendment, page 2, line 22, say aye.
Aye.
Aye. Opposed, say no. That amendment has passed the committee. Let's go to anything further on page 2. Seeing none. Page 3.
Mr. Chairman, I move page 3, line 4, after commissioners insert prior to the public hearing.
Okay. Line 4, after commissioners, prior to the public hearing, added. Inserted. Any comments on that? Discussion, questions? Question on Senator Dockstetter's motion on page 3, line 4, inserting prior to the public hearing. All in favor, say aye. 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 Opposed, say no. That amendment has passed the Labor and Health Committee. And then,
Mr. Chairman.
Go ahead, sir.
Continuing, as I see it, on page 3, after page 3, you need to go to 18.3.525 and add 1812-105. And then the note from the clerk, I'm guessing you have to add this, or the commissioners can't dissolve them since this section is not listed. So it's simply adding that section.
Adding a section where you.
So we would put that on.
Where is that?
Okay.
Oh,
Move that
okay.
in line
Got you,
6
line
there.
6. Okay.
Okay, that's where it is.
Very good. Any discussion on that, committee? All in favor, Senator Dockstetter's motion on page 3, line 6, the amendment as offered, please say aye. All opposed, say no. That amendment has passed. Anything on further pages? Page 4, page 5, page 6, page 7. Anything in addition or any further amendments the committee wishes to offer?
I'm gonna,
Senator Dockstetter.
Mr. Chairman, I'll be with the bill to move it out of here, but we'll see. It's, I think about some of our own situations at home, bonding, adding for extra fees, anything like that has not gone over well. Even to the point that they have a fire district looking for additional funds that they've decided to stand back for a while. And so we'll see. They may take it home to the home county and say, this is our way to get these services, but it'll be ultimately up to them. But it's kind of a different atmosphere out here now for additional taxes, fees, or anything like that. But I'll be an aye vote.
It comes to mind too, recent similar things that were brought forward in our county and then in a bordering county for improvements, potholes, equipment, et cetera, that failed. But I suspect that everyone might not be in its favor, but I think it's a tool we can propose. If they want to do it, they can do it. If not, Senator Bouchard, go ahead.
And Mr. Chairman, I just want to explain my no vote. I've watched my county commissioners talk about tons of issues to put on a penny tax. And there was always all these issues that they brought as their pet projects. And I'm a firm believer that government should do things that people can't do for themselves. But there is a process, and there's so many wants that are put in front of the things that are necessary at some of these meetings with county commissioners, that I think that's where the problem is. And so that's where I'm having heartburn with doing another district. And I certainly have a heartburn that this isn't a general election where people do come to vote, so.
Very good. Further comments? Sensing none, we're ready for the question. Go ahead.
Thank you, Mr. Chairman. Senate File 43, EMS districts as amended. Senator Barlow.
Senator Barlow, left hand, aye.
Senator Bouchard.
No.
Senator Dockstader. Senator Hutchings.
No.
And Chairman Baldwin.
Aye.
We have 3 ayes and 2 noes.
Senate File 43 has passed. Labor and Health Senator Case will take care of that on the floor. Okay, and I would just give a couple of heads up before we move on to the next bill here that I already misplaced. that we're likely not going to get to the fourth bill on the list, which is the Right of Healthcare Access Constitution Amendment. That will have to be moved on to another meeting. That's the first announcement. Second announcement is we have a large number of people who want to comment or who want to publicly comment on the next bill. Because of time constraints, we have an hour left essentially. We're going to let the presenter of the bill present the bill and take the time that he needs. Beyond that, we're going to time limit. If some of you were here for the testimonies yesterday, you know I limited 2 minutes. We're going to extend that to 3 minutes today with the nuance that if we get too close to that hour, we will back off the 3 minutes and try to get this bill done today and out of the committee. So, Senator, come forward. Welcome back to your favorite committee, your old committee, Senator Scott.
That's Mr. Chairman's first time I've been back.
How does it feel to sit on that side of the table instead of this side?
We'll see.
This is Senate File 111, Child Abuse, Change of Sex. Go ahead.
Mr. Chairman, I know this is the Health Committee, Mr. Chairman, but I'm bringing you a criminal code bill. And it's something that you have to be convinced that the action we're talking about here is criminal and not healthcare. What the bill does is it makes changing the sex of a child and defines child as anybody under the age of 18, standard definition. It makes changing the sex of a child abuse, which is a felony. Let me explain the need that I see that caused me to bring the bill. There is very commonly, Mr. Chairman, when an individual hits puberty, there's often some confusion about issues relating to sexual and gender identity, that sort of thing. Most people, that straightens out pretty rapidly as just normal part of the growing up process, I think, Mr. Chairman. But it does affect a number of individuals a good deal more severely. And there is a fad, I will call it just plain that, because I think that's what it is, among some of the adolescents of trying to solve the confusion and uncertainty by changing their sex. Again, most of them, I think, grow out of it and are content with who they are. But what's happening is that people are preying on young adolescents that are having that kind of confusion and persuading them that the way to solve it is to get their sex changed to the other sex. And that has terrible consequences. When you do that, my understanding is the first thing that you're giving up is the ability to ever have your own child, ever. That you lose that forever. There's often, if they really change sex, there's often basically mutilating surgery that's done. You never successfully change all the way because you still got the chromosomal structure that you were born with. That's not changeable. And that has effects. And these younger children that are involved in this simply do not have, they haven't been alive long enough. They haven't got the experience with life to understand the real implications of what they're doing, and they just don't have the maturity. They don't know what it's all about yet. And say most of them outgrow it, but you're doing something, if they get a sex change, it's basically irreversible. And I don't see any way that they can give informed consent to this, because they just don't understand. So what the bill does is, if you look at the bottom of page 1, it adds a new subsection D to the child abuse statutes. And what I did was copy the language from the subsections that are just above it, that are not shown in this bill. So that, and put into it the appropriate requirements for this crime. A person is guilty of child abuse, a felony punishment by imprisonment for not more than 10 years. That language is just copied right out of the pieces above. If a person intentionally inflicts upon a child under the age of 18, any procedure, drug, or other agent or combination thereof that is administered to intentionally or knowingly change the sex of a child. So you've got all those elements there. And then we added one sentence that wouldn't be appropriate elsewhere. Consent of the child's parents, guardian, etc., is not a defense to the crime defined by this subsection. That's making it very clear. In healthcare, you could do things with consent of the parent. This is criminal. That doesn't suffice. Then there is a set of exemptions following not constitute child abuse. I go through them very briefly. You get medical treatment where you have very rare instance, but it does happen, where you get somebody born with ambiguous sexual identity. And my understanding of the common medical practice is that the doctors and the parents get together and say, okay, need one, you got both, you need one or the other, and deal with it. And that's limited, you have to diagnose it early. Second, medical treatment associated aftercare of child born with the external genitalia of female and the chromosomal structure of a male. This is where you have the XY chromosome structure and the female body plan, which is in human development turns out to be the default body plan. And that's often discovered later in life. It's, again, very rare, but it's been publicized, and there've been some cases quite notorious. They often find it when they get to testing athletes. Or sometimes, why is the girl not able to get pregnant, not having periods, that sort of thing. And they do a chromosomal test. So that's often that's discovered later than this bill would cover when they're adults. But if it does get discovered in somebody who's still a child, you got to be able to deal with that. So that's an exception. Again, very rare. The lawyers had me put in going the other way, and I think that is so perishingly rare that basically it doesn't occur in nature. The item 3, treatment of a child develops whole or in part characteristics of the other sex, and the treatment's designed to just ameliorate that, deal with that. And that'll happen. Boys will sometimes develop female breasts, often as a byproduct of another serious disease or the treatment for that other serious disease. You got to treat that, and you're not trying to change their sex. You probably don't need that, and that's in there just in case the doctors are afraid to treat that properly, given this, and I don't. So that's that one. And then finally, medical treatment associated aftercare necessary. We got a traumatic injury or life-threatening physical disease, not including psychological or emotional. Physical diseases, it's clear you need to do something, I think. Some of the mental ones, you get spectrum disorders, and that, if you allowed this kind of sex change result of those, you'd create a loophole that would be just impossible, Mr. Chairman. What I've tried to do, Mr. Chairman, in this bill is to keep it as simple as possible. You know, you can get into a lot of details, get lost in the weeds of medical treatment. So I tried to make it simple. The standard is, did they intentionally change the sex of the child? If they did, it's a crime. If they didn't, it's not a crime. I think that will take care of 80-90% of the problem. It will enable other adults that are dealing with the confusion that you get in puberty here to understand that you have to help the child through this, let them grow up, and not try to change their sex to solve the temporary distress that they might be in. We may have to come back if somebody gets creative and finds a way to get around this and put a stop to that. But I think this will solve most of the problems. And that's about as much as we can hope for in legislation, Mr. Chairman. You never get it quite perfect. But this establishes the principle. And I would urge the committee to assist me in keeping it simple. Mr. Chairman, that's the bill. I've seen personally cases where there've been abuses in this area, where counselors tried to persuade an adolescent to do a sex change. A case I happen to be familiar with wasn't in this state. The parents managed to talk the child out of it. But I think there's risks here in this state. It's happening all over, and I don't think we're immune to the national feud, and I have anecdotally heard of problems in this state. So with that, Mr. Chairman, stand for questions.
Thank you, Senator Scott. Questions, committee? Senator Dockstader.
Thank you, Senator Scott. Noticing some other states addressing similar legislation, but you're probably correct in your summary. They seem more complicated or a little more detailed. You kept it basic because you want to focus again, if you'd repeat that, focus on what?
Focus on setting the principle that this is child abuse. I think if we focus on that, we get most of the job done. I think the other states are trying to, I looked at some of those, they're too complicated. You get into the weeds of medical treatment. You get into the weeds, you forbid something that is also used for something else. I think we're much better off trying to keep it focused on, if you actually change the sex of the child, that's child abuse.
Further questions? See none from the committee. Thank you, Senator Scott. Have a seat nearby. If you remember testimony yesterday, we have 4 seats up here. I'd like 2 pro, 2 con, or not con, opposed. So if you would, we'll do the supporters on this side, opposition on this side. So please, Rue. First of all, is there anybody from any agency here? I thought we had somebody earlier, they're gone. So let's go ahead and start beginning through the room. I need two supporters over here in these 2 chairs, 2 opposition over here, and we'll work our way through. As soon as your testimony is done, go ahead and go back to your seats and let somebody else occupy the now warm seat. Go ahead, ma'am. Welcome back.
Thank you, Mr. Chairman. Hello, members of the committee. As you may remember, I am Mara McManaman from Goshen County in Torrington, Wyoming. I am in support of this bill 100%. Please vote aye on this bill. Thank you for your time, and I'll stand for any questions.
You get the second shortest testimony of the day. Thank you very much. Appreciate you being back with us. Mr. Winnie, go ahead, sir. Any questions, committee? No, go ahead, sir.
Mr. Chairman, Bill Winnie, Sublette County. Along the way of my 30 years active duty in the Navy, I served as commanding officer twice, total of about 5 years. I was leading a number of people that were in what is probably the higher age bracket of what's contemplated in this bill, 18, 19, 20 years old. But I think the things I observed and learned would serve discussing with the bill. by the way, I support the bill. On one ship I was on, I saw a young man pulled into a system. The military has a system for treating alcoholics. And I saw one young man pulled into that system that was labeled a dry alcoholic. And I thought that odd. He didn't have a problem. He worked fine, everything. Let the young man go into the system and, the system did what it did. He came out. At the end of the process, as I looked at this young man, I concluded he had been drawn into a system that had projected onto him some of their own attitudes or whatever. And so I've concluded in looking at young people, what do they need? They need to see adults that they can model after, but they don't need adults pushing things onto them. And I think that's a gist of what this bill is trying to get at, is don't push things onto kids. They're receptive sometimes when they shouldn't be. You might recall several decades ago, certain parts of this nation went through what should I call it? Anyway, child abuse and demonic thing going on in child care facilities, and things went on and people were prosecuted. And after that ran its course, the legal system finally concluded, that probably wasn't what we should be doing. So the issue of projecting onto young people is very important, and I think that is exactly what Senator Scott's bill gets at. So subject to your questions, thank you.
Questions, committee? Sensing none, thank you very much. If you two would go ahead and trade your seats somewhere. Go ahead, sir.
Hi, thank you for your time. I'm Bob Prentice, retired pediatrician, 50 years in pediatrics, 44 here in Cheyenne. I got a gravelly voice. I apologize for my cold. I strongly object to the criminalization of treatment of the children. And as a pediatrician, thinking that I might be the one that goes to jail for 10 years for doing something that I think is within the realm of medical care and appropriate, frightens the heck out of me. And maybe that's probably what Mr. Scott's plan is, but I just don't think it's right. I think it should be left alone. It's a medical thing, something between the children and their families and their doctors. The American Medical Association, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry all have statements saying that criminalization of treatment is inappropriate and should be left out of the law books. I could say more. I'd be glad to answer any questions.
Questions, committee? See none. Thank you, Doctor, coming in. Go ahead, sir.
Thank you, Chairman and Senators. I'm Richard Lennox. I am a retired teacher and a small business owner here in Cheyenne, Wyoming. I came to speak against this bill, primarily looking at the Romanet number 3 on page 3, where Chairman Scott did mention a specific characteristic, but the bill does not mention physical characteristics. So my concern is where this harkens back to if a child is displaying, maybe a boy is displaying feminine characteristics or a girl is displaying masculine characteristics, because that's the word here in the bill, that those parents are okay to seek medical input and intervention. And it kind of harkens back to that gay conversion therapy. I did send you guys an email about that, and I did mention that many states, if not half, have already outlawed that practice. The most recent was Utah 2 years ago, outlawed and banned the gay conversion therapy. And this bill seems to be going in the opposite direction of what the trend is in the country, to tell those parents, yes, seek medical treatment or mental treatment if you don't like how your child is acting. But if a parent wants to support their child and who they are, that we're going to criminalize. And that just seems really, it's a bill, it's a Senate file that kind of has two separate kind of messages in it. Also, it seems to be that both the House and the Senate this year are actually sending two different messages as well. There's a lot of parent rights bills and files out there that are supporting parents, but this one actually goes a 180, and now we want to criminalize the parents in this topic. And it's certainly a topic that the conversation is important. We certainly need to talk about this. We certainly need to learn how to navigate through these new issues, both in the healthcare, with this body, but to jump to criminalizing it is really just a step too far. With that, I'll stand for questions.
Questions, committee? Seeing none. Oh, here's one. Senator Bouchard, go ahead, sir.
Thank you, Mr. Chairman. Mr. Lennox, I just want to be clear that this bill doesn't have anything to do with homosexual tendencies. One of the studies that I personally looked at, up to 92% of the children that were just left alone, the rest actually had homosexual tendencies and went on to live a normal life. So that's what's going on here. So, I mean, do you understand that this bill is totally different than what you're talking about?
I do. And I thank you for that question, Senator Bouchard. Mr. Chairman, I was going off the language here. And I did hear Senator Scott mention something about breast and mammary, those characteristics that were physical. But this does not say that. So that's kind of where I was coming from, looking at the language on page 3 there, lines 1 through 5. It just seemed like, it seems very obscure or kind of too broad, where we're looking at more. The intent seems to be that was a physical characteristic, but it's not reading that way to me.
Quick follow-up, Mr. Chairman. To be fair, he was talking about if they had to make a change for something physical that happened that has nothing to do with a child is even going through this process. That's what I got from what Senator Scott was talking about. Thank you.
Okay. Let's go. Oh, Senator Cockster, go ahead, sir.
For a doctor, sir?
Sir.
Doctor, sorry.
Thank you. Many years of service that you offered. Thank you for your help there along the way. Are you opposed to anything specific or just the overall concept? Did you read the bill as far as the wording?
I've read the bill and I understand the reason that those exceptions are there, and that's appropriate. But I also think that in a time when we're concerned about mental and physical health of people, that we don't allow children and their families to make decisions in this area just as they would about treatment for diabetes or cancer or whatever. This is not taken lightly. This isn't a journey anybody really wants to go on. And they need all the support they can get. And over the years, I've had to treat kids or help treat kids or make treatment available for many, many medical conditions. And I'm not sure how you would police this. I get worried that it would almost be, turning your neighbors and your medical staff into tattletales. Nobody does this kind of work for fun or for profit. No surgery is done on any children under 18, at least in this area. I think some mistakes were made in the past, but I think everybody's aware of what needs to be done and done slowly and deliberately. So I don't agree that, I think in essence, not allowing referral and treatment that specialists might recommend is wrong. It's just wrong. It doesn't recognize the mental health of the children, and it is discriminatory.
Thank you, Mr. Chairman.
Okay. Thank you. Okay, we got two new folks up here. That empties two chairs. Two preferably in opposition. These two chairs are for supporters, those two chairs are for opposition. Go ahead. I saw you arm wrestle, I believe. Representative Odman won. Go ahead, Representative.
Thank you, Mr. Chairman and committee. I would speak in favor of this bill and am I'm a supporter of it. And the main reason is because it's to handle something specifically, and that's mutilation of a body of a child under 18 years of age, to remove breasts, to remove testicles, to create different things in a young person's body at a time when they are developing physically and mentally and emotionally is just cruel and unusual. All go through stages in our lives where we have confusion. As was stated earlier, there's mental health problems after this pandemic and things. And people are at a stage where they need to have the time to regroup and to think about what's going on. If there is reason to believe that this might be a way that you would like to go, there's testimony of people that had the transition operations when they were adults. They could make that decision themselves. They didn't have to go through all of the physical growth, numerous operations for years, drugs, probably for the rest of their lives. And that's a lot on a child. And also, the bill covers that if there is evidence that this might be a physical thing at birth, that up to the age of 4, that can be done. So I would just say that I am for this bill. I thank you for your consideration. I'll stand for any questions.
Questions for Representative Ottman? Seeing none. Thank you, Representative. Deacon Lehman, go ahead, sir.
Thank you, Mr. Chairman, members of the committee. My name's Mike Lehman, representing the Catholic Diocese of Cheyenne. And I just want to say to open, it's critically important to remember how difficult the process of maturation from childhood to adulthood is in any circumstance. And then add a compounding difficulty of what it feels like for a young person who experiences discordance with his or her own biological sex. Think too of the powerlessness we feel as parents, unable to soften the blows of life's lessons. We sit nearby and anxiously pray and hope that our children find a way to keep getting up again. And then someone mentions the words of suicidal ideation and you hit your knees. You're ready to listen to anyone who promises a tomorrow for your child. It's important to understand these experiences, to understand why there may be some animosity for those of us who question the validity of the promises that are being made. The truth is, every claim that suggests that gender-affirming care is successful at mitigating suicidal ideation is qualified by the admittance that there are no long-term studies currently to inform us on how this impacts children in the long term. Perhaps as a parent, one feels that if it keeps my child alive for one day, then it's worth doing, and that is certainly understandable. But real science isn't supposed to make assumptions or promises. It's supposed to help us be informed, fully informed. And as Senator Scott mentioned, the brain development at that young age is not fully developed. And as parents, this particular situation is still very new to our society. And so being fully informed, that's a very high standard for us to meet. We know that puberty blockers impact bone development. We know that cross-sex hormone treatments and surgeries can lead to infertility and sterility. Because sex chromosomes, pairs of X and Y, are the cause of our expressed biological sex, ultimately these treatments do not succeed in actually changing sex. They merely succeed in changing appearance according to social gender stereotypes. Because these chromosomal indicators exist at the cellular level, affirming care, which seeks to change and prolong the stereotypical appearances of the opposite sex, requires lifelong medicalization of these children. The Society for Evidence-Based Gender Medicine recently published an article highlighting a challenge to the Dutch study that claimed gender-affirming treatment led to positive outcomes for children. And I quote the Society's summary of this article. And the article was titled "The Myth of Reliable Research in Pediatric Gender Medicine."
15 seconds.
Well, I will have to cut it down significantly, Mr. Chairman. Ultimately, it questions the validity of the research that was done in these Dutch studies that are often quoted. And Mr. Chairman, I just want to say, finally, ultimately, as parents of children, regardless of what they're experiencing, we have to remain in contact and communication. It is important that we do that. And with that, I will end because I know I'm at the end of my time.
Thank you very much. Questions for Deacon? Say none. Thank you very much for coming. We'll work on your fast speech. Yeah. Okay, let's go on down. If somebody wants to come up and occupy those 2 seats, this would be supporters. Go ahead, sir.
Good morning, Mr. Chairman, members of the committee. Dr. Hollis Hackman, I'm a psychologist from Sheridan, Wyoming. I'm representing the Wyoming Psychological Association. I'll be brief here. We're opposed to this bill. There's ambiguity in here about the role of mental health providers. And Mr. Chairman, this is not my area of expertise. We may have a provider who specializes in this area that has tried to Zoom in this morning. I don't know if she was able to make it or not, but I would just point out that childhood gender dysphoria is a diagnosable mental disorder, and we have providers that work in that area. They provide behavioral health interventions to address issues and help head off complications that can lead to bad outcomes, mentally speaking. So just briefly, we're opposed to this bill as it presently stands, and I would stand for any questions.
Thank you, Mr. Hackman. Senator Dockstader, your lights on.
Dr. Heckman, your association, is that when they come to a decision like this, is it a full vote, unanimous vote, a majority vote? How do they decide to come out in opposition?
Mr. Chairman, Senator Dockstader, that's a tough question. Things happen rapidly at the legislative level with bills that come forward. We do have a listserv, and when I'm made aware of a bill that might impact our profession, I throw it out on the listserv immediately so I can get input from our colleagues and providers that are part of our association. And all the comments that I've received on that listserv in the last 48 hours since I really got aware of this bill are all negative and are not in support of the bill.
Thank you. Further questions for Mr. Hackman? No. Go ahead.
Good morning, Mr. Chairman and members of the committee. Thank you for your time this morning. My name is Amber Pollock. I'm from Casper, Wyoming. I come before you today to express my opposition to Senate File 111. I'll start by saying I don't think the members of the Wyoming legislature have a full understanding of trans issues. My apologies if I'm wrong and you have in fact had a close personal experience with a trans person navigating the world or have really taken the time to learn from experts in the related fields, but I would guess that's likely not the case. And I don't say this to call anyone out because the truth is most people don't have a full understanding of trans issues. They can be complex and difficult to relate to. And for many people, it won't be something they confront directly in their lives. And generally, I would say it's okay that most people don't fully understand it. You don't have to understand something to be kind and respectful of folks. But today in this room, it's not okay to not fully understand it because you are in a position to make life-altering decisions for Wyoming families. You are positioned to make felons out of parents who are faced with making very difficult decisions in the best interests of their children. And if that's not a responsibility that requires a complete and accurate understanding before proceeding, I don't know what is. The road to a better understanding of this issue is laid out by many people in this room. Folks who have walked this path can provide accurate information about the experience. I would suggest that perhaps the best response to feeling like we don't understand something is to not assume that folks who are experiencing that thing must be doing something wrong or are somehow incapable of making good decisions on behalf of themselves and their family members. Instead, we can work to listen to the families who are being directly affected and let them be the experts on what the best way to deal with these issues is. I believe that these parents want what's best for their kids just as anyone else does, and are in the best position to understand what that is. And if you can put yourself in their shoes for a time, I suspect that even though maybe you couldn't understand, you would want to be able to do whatever you needed to do to help your kid without interference from the legislature. I urge you to vote no on this bill to preserve parents' rights to work with professionals and do what's best for their kids. Thank you.
Thank you, Ms. Pollock. Any questions for Ms. Pollock? Seeing none. There's 3 empty seats. Sir, you occupy the lone seat up there now. Go ahead.
Good morning, Chairman Baldwin and members of the committee. My name is Steve Milley. I'm a resident of Cheyenne. I have a master's in public health and I've been in public health education, which includes sexuality, for the last 30 years. We are telling and we are confusing our kids. As Mr. Winnie had mentioned, they're being pushed into a line of thinking. We are telling Johnny that his brain is in Susie's body and that we have to castrate him and grow him breasts, etc., to make him into a girl. And then we're telling Susie, well, your brain is in Johnny's body and we have to cut off your breasts and remove your uterus to construct a penis for you and make you into a girl. And to think that there are councils out there, as Mr. Winnie had mentioned and some others had mentioned, that they are performing these surgeries and pushing these types of ideas onto the children, that the only thing to do that you can do is to change your sex. We have outlawed in some parts, I believe here in Wyoming also, a few years ago, female genital mutilation. How is this any different when we take body parts from other people? The body is correct, actually, and it's a mind that needs to be modification to accept its actual reality. And if a child can decide their sex, then when will we allow children to decide what species they are? There are people who genuinely believe that they are dogs and cats and wolves and elves and deers and aliens, etc. And I can send you information on this. I was researching it, and they have spent thousands of dollars in multiple surgeries to alternate. They call it body modification, but it's also mutilation. It's also called BIIN, Body Integrity Identity Disorder. It includes people who believe that parts of their body, which are perfectly good and working, are wrongly attached and they need to be removed. And that includes arms, legs, hands, eyes, and genitalia. Deacon Lehman had mentioned about the depression and suicide. These are not the result of people who support this bill, but those people who push this information, such as Mr. Winnie had mentioned earlier, and it confuses children. Gender affirming needs to be affirming the person's biological sex, their gender. There's male and there's female, and not surgically altering the body and whatnot. So there's many facets to this, but if you take perfectly good working body parts, breasts, penises, testicles, uterus, and say, nope, they're wrong, God made a mistake. Well, I don't believe in God. Well, evolution made a mistake. Well, I don't believe in evolution. Nature made a mistake. Whatever you believe in, how can you say that, oh, the body is wrong, somebody made a mistake, and we have to completely reconstruct the body to fit the mind, as opposed to change the mind to fit the body. So I totally support this bill, and I ask for your yes vote on it.
Questions, committee? Seeing none. Go ahead. Whoever won the arm wrestling.
Mr. Chairman, thank you. Let me get this right. There you go. My name is Andrew Rose. I'm a pediatrician at the Cheyenne Children's Clinic. I'm also representing the State Academy of Pediatrics today. I'm the current president of the Wyoming chapter. And I come in opposition to this bill for many reasons, but I just want to go through some notes I wrote. For 10 years, I've been here in Cheyenne helping families and kids, and at times I've had to be there when kids have felt boxed in by their gender that was assigned at birth. These kids and these families, as Dr. Prentice said earlier, they don't seek this out. They're not, you know, they don't want to find themselves in that situation, especially, why would they? Especially here in Wyoming. And no, these kids aren't just confused. They're not immature. They're not just in a state. Instead, they identify in a way that society tells them they shouldn't. And of course, that creates dissonance. In respect to Senator Scott, who's never taken care of children or probably really talked to teenagers that have been in the same situation, or the families going through this directly, no, this is not a simple problem. This is not just X's and Y's, and you're not looking, I mean, if you are looking for a cause, We're talking about differences in brain chemistry, not just a whim or a adolescent phase or fad, as was mentioned. The dissonance that I talk about, felt by these teenagers, is problematic. It leads to a whole host of issues, including depression, anxiety, homelessness, and suicide when that's allowed to continue. And it's been proven, and really makes sense, that if there's a society that refuses to affirm people where they're at, no matter what the issue is, those problems are going to get worse. And the alternative is true too, however. The sooner that we accept kids where they're at, the better those outcomes will be for them. So really, if we want to do something that actually is beneficial and protects children and teenagers, why doesn't Wyoming start by taking on the task of reducing suicide rate? Because right now, teenagers with gender dysphoria are arguably the most at-risk group of kids at that age for suicide. Let's actually provide acceptance and the gender-affirming care that they need, the care that's been proven to decrease risk of suicide, said over and over. And we won't accomplish this by sending messages to physicians and to parents that they will be locked up for doing the right thing for children. And regardless, here in Wyoming, we're not doing surgeries. There's no one doing the irreversible therapies on kids here in Wyoming. The hormone therapies that are spoken about, that could be given in our state, probably prescribed out of state, those hormone therapies are meant to delay puberty. And true, there are problems, like the research isn't complete in terms of effects on bone and long-term.
15 seconds.
The long-term effects. So but the things that are done currently would be reversible. Frankly, in good conscience, I just don't know how a group of supposed proponents of limited government and individual liberty who don't have expertise in the area want to take away parental rights and autonomy and make it a felony for physicians to practice here and to do the right thing for kids. And if that continues, I don't see myself and most of my colleagues wanting to practice in a state where that is true. Thank you.
Question, Senator Dockstader.
Thank you, Doctor. Thank you for coming. Similar question to our state psychologist. This is a unanimous vote in your association?
Go ahead, Doctor.
Sorry, my colleagues and I, we communicate primarily, because we're so spread out, via a kind of email and internet network. And so we haven't had like a formal vote, but at our last meeting, we had discussed gender affirming care at our society meeting in October, and that's where the sort of more or less consensus has come from.
Thank you, Doctor.
Further questions, Senator Bouchard.
Thank you, Mr. Chairman. Something that you said, Doctor, about being reversible. I mean, one of the questions that I'm asking is how do you reverse a removal of mammary glands to the point where they've scraped down, even taken away all the tissue that has the ducting? And the other thing is, you mentioned something about depression and other mental illnesses. From the studies that I've seen, which includes up to 92%, they did not treat just those depression and other ailments and went right to what they said was a transgender problem. But yet, in those same studies, if they just got them through the depression and the other ailments, they would get through life and actually even be comfortable in their bodies. Maybe some of them would have homosexual tendencies. It was a very small percentage. Isn't that doing no harm? I mean, when we start taking a scalpel out and start doing procedures, we're doing something totally different. I'm just not sure it's reversible. And I just want to add one more thing. I've done a deep dive into this, and I've seen some of the surgeries they're doing in some of these hospitals, in children's hospitals, mind you, although they haven't. Some of them aren't children yet, because they're trying. It looks to me like they're trying to do it in people that are over 18 in children's hospitals as they move to make it acceptable. And they've done what they call, I mean, I don't know what the procedure is actually, what we would call it in the layman's terms, but they're adding what they call a penis that's no bigger than the tip of this pen. And I wonder what the ramifications are to somebody who they've convinced that that's okay when they get older and figure out that, wow, that doesn't look normal.
Doctor, go ahead and answer those questions.
Chairman, thank you. So to speak to the first point, when I mentioned reversible procedures, I'm discussing hormone therapy primarily that is based on blocking the progression of sexual maturation, so which is reversible. And what I had said is that no one here in the state of Wyoming is doing the types of procedures that you graphically explained for us all. And frankly, if those kind of things are being done, we as an Academy of Pediatrics would also oppose that. However, to blanket, restrict, and criminalize the processes that take a long time to work through. Yes, we're treating depression ahead of time, and yes, we're trying to deal with the anxieties and everything else that comes along with this very difficult and very complicated situation. As was mentioned by a speaker before me, this is not simple, and yes, we try whatever we can do in the least harmful and lasting way. So we are definitely going to be doing, we always abide by the rule of do no harm, but I don't think we can ignore the statistics that children with gender dysphoria have such a higher rate of all these things: depression, anxiety, homelessness, suicide, that it would be irresponsible to not fully be able to use our entire toolbox at the outset. And I'm not saying we need to do this in any kind of genital manipulation or mutilation, as was mentioned, but we don't need to criminalize and make it so that people like myself don't want to practice here.
Okay, thank you. Go ahead.
Sir, I had a
Go ahead, Senator Hutchings, quickly, please.
I'll try. Doctor, do you have statistics on those people that have been transitioned, their rate of suicide?
Go ahead, doctor.
I don't have those exact statistics, no.
Thank you. Quick follow-up, Mr. Chair.
Go ahead, ma'am.
Sir, you talked about reversal of the hormone therapy. What happens to the body? Let's just say you started the hormones therapy at 12. Now I'm 20. I don't want to go through the therapy anymore. You stop the therapy. What happens to the body?
Go ahead, doctor.
Mr. Chairman, thank you. So, it depends on what we're talking about. Hormone therapy is a pretty broad topic, but if you're talking about just puberty suppression, I don't think there's many that would continue puberty suppression for that long, just because of what we know about potentials with bone mineralization, et cetera. But I will say that some types of hormone therapy, like if you're talking about estrogen therapy and testosterone therapy, those I wouldn't say those are completely reversible. when I mention what is happening in our state potentially at the current moment, we're talking about there are some hormones that are meant to stop the progression of puberty, and those are the ones that might be used just to allow these children and teenagers a little more time to go through social transition and to make sure that this is the right decision for them. It's not, we're not doing estrogen, testosterone therapies like that. So, and to answer your final question, if those hormones are given, there could be, there are some risks with those therapies too. But we have been using sex hormone or puberty suppression, I should say, those types of medicines for precocious puberty or early puberty for decades. and they work in younger children without long side effects. But I will say we haven't been using them probably for long enough to know any really long-term effects. Like,
One super quick.
Let's move on and get the next testimony first, because we're
This
running out
could
of
be
time.
for both. This
Well,
could
let's
be
get
for-
her testimony
okay.
first, and then we'll decide. Go ahead.
Chairman Baldwin, committee members. My name is Jennifer Muma, and I'm a licensed clinical social worker here. I practice mental health in a private practice here in Cheyenne. I've received advanced training in gender affirming care for all people, including transgender and gender expansive individuals. And I've been providing these services throughout Wyoming, not just in Cheyenne, for over 11 years. I'm well versed in the standards of care, which have not been mentioned yet, is the governing body of what physicians, mental health providers, doctors, any kind of provider of medical services are generally followed in our country as guidelines for practice in terms of transgender care. This is published by the World Professional Association for Transgender Health, also known as WPATH, and I am also a full member of WPATH. So my testimony today is in opposition of this bill. The reasons for this are that gender affirming care is a medically necessary care that can be life-saving for transgender youth. Medical necessity and medical decisions, I strongly believe that belong between trans youth, their parents, guardians, and medical providers. The standards of care also includes the mental health provider's role in that as well as a form of ensuring that this whole process is comprehensive. It's something that's including the the mental health component in regards to gender dysphoria. There has been research that this bill will criminalizing gender affirmative care with minors can negatively impact their mental health, to include depression, anxiety, risk for suicide. I know that there's been some concern around detransitioning. We've kind of thrown around that idea around growing out of their their transgender identity. And from the research that I have done, the outcomes of that have been generally overemphasized, and the research doesn't seem to offer sound reasons to oppose or delay gender affirming care, including any kind of pre-pubertal society or transitioning with medications. I think what I would ask is to trust the process. These organizations, my organization, the National Association for Social Workers, WPATH, the Standards of Care, many of these others, have created a very detailed research evidence-based process to ensure that these services or surgeries or hormones are not just being accessed because somebody's being preyed on, or so that because it's a fad. This is taken very seriously by my profession amongst others. And so that I ask that you trust the process that's been laid out. On a personal note, and my final note, as a mental health provider, I've experienced firsthand the negative impacts that bills such as these have had on trans minors throughout Wyoming. Aside from my experience as a therapist, I've also worked in the ER. I've seen again firsthand from that perspective the devastation that non-affirming care and actions against trans youth have had. And I can say that my experience has matched that of the research that's been provided. I know I sent out some documents with additional reference and research, and the outcomes are not good.
15 seconds.
Thank you for your time, consideration, and service to Wyoming. I stand for questions.
Senator Hudson, you had a question?
I did, but I'm going to hold off.
Okay. So committee, we're going to have a choice here before we get to your representative. We're going to have a choice. I've got a dozen people sitting online, probably more sitting here in the audience. We can continue this bill. We can close public testimony and take a vote. It's at the committee's pleasure, what you would like to do. Senator Barlow.
So, Mr. Chairman, I think we take the one person at the desk and then we try to get many as we can offline, because those folks have been, stopped their days. Anyway, what do you think, Mr. Chairman?
Senator
It
Doctor.
certainly has to be
Mr.
continued.
Chairman, how many in the room did they come to testify?
How many in the room are here to testify?
How many have something different to say?
Okay, out of all those who have their hands raised, how many are here in support of the bill? Raise hands. How many are here in opposition to the bill? Okay. So committee, further comments? Obviously, we're not going to make it through all that testimony today.
Mr. Chairman, I just hesitate to, if people come to testify that, and we don't have time, then we delay it.
Point-
pulled a scalpel
Point well taken.
Thank you.
What I'm concerned about is people that have traveled here
from
today,
Sheridan.
if they traveled. So how many have traveled who are not here from Cheyenne, I guess would be my question. Come up here up front, please. We'll take testimony of those who have traveled from out of town.
Mr. Chair?
Yes, ma'am.
Can I ask how many have something different to offer instead of just the same thing over and over?
I suspect that 90% will say yes. So, yeah. So if all those folks from out of town who have traveled here today to testify, if you want to come up and please come to the chairs. Seeing none. Seeing none. Let's go ahead and take testimony, Representative. We'll take testimony of you two, and then we'll decide what to do. So go ahead, Representative.
Thank you, Mr. Chairman, and thank you, members of the body. I just want to address a couple things that I've heard here this morning. First of all, I do believe that this is a fad. If we look historically at how long this has been an issue that has become centrally focused in our society, and I believe politicized, it is recent. And we see a large number, an exponential increase in the number of people that are being affected by this, what I'm going to call a fad. So if that's the case, I have concerns about our counseling associations and our counselors that are promoting a dysphoria or a treatment of a dysphoria that is very different from every other type of dysphoria that they treat. If we have anorexia, for instance, we don't treat that by affirming and then having surgery or some other invasive action to mitigate that. We adjust or we treat the mental illness that has led to that, depression, whatever may have come from that or caused that. So I have concerns that in the long run, if we continue to treat this way, and people continue to come of age and then find out that they really don't want this, they've already trusted in their parents when they were youth, who were advised by these counselors that this is the only type of treatment. And now the very people, their parents and the counselors that might help them reverse this situation, they're not going to be able to trust them because that's who led them into the situation. So I'm very concerned about how we're treating this particular dysphoria, especially amongst children. I believe that's what the bill addresses, is children. And along those lines, I just want to say that we as a legislature do have a responsibility to be involved in these things because we do have a responsibility to protect those who are of a minority or who don't have a voice. And in this case, we're talking about children who definitely don't have a voice in the legislature. So with that, I am on and for the bill and appreciate your time.
Thank you, Representative. Ladies, go ahead, ma'am. Whichever ma'am wants to jump in there. If you can keep it down to 2 or 3 minutes, appreciate it.
Very sorry. Thank you, Chairman Baldwin, for this opportunity. Like I said before, I'm Rebecca Franklin. I am an OBGYN in Sheridan, Wyoming, and I've been there for 10 years. I do hold a scalpel a lot, and it's one of my favorite things in the whole entire world to do. I really, as awful as that sounds, enjoy blood loss at a very alarming rate. And so I've chosen the profession in which blood loss is very common. And I'm not trying to make light of the situation, but surgery is a incredibly thoughtful process that takes an incredible amount of time and skill to learn how to do. And it also takes an incredibly thoughtful process to decide to do surgery. The best surgery that I can do is actually to not to do surgery. And so I try very hard to counsel all of my patients about all the risks and the benefits of any surgery they're potentially going to undertake. As far as gender affirming surgery, there's currently no gender affirming surgery happening in the state of Wyoming. and it is definitely not happening on children. This bill was thoughtful enough to include a lot of exemptions for very rare medical conditions. And yes, those surgeries do sometimes occur here in this state, but many times they're traveling out of state to have those surgeries. In adults, to have gender affirming surgery, most of those patients are spending at least a year on hormones before any surgery could even potentially be accomplished. And I want to leave time for lots of questions about surgery, specifically in these children, because I'm not a pediatric surgeon. I'm going to try and leave it to my expertise to answer those questions. But I think it's really important to understand that criminalizing physicians, criminalizing surgeons, especially because there's very few of us in the state, sets a really terrible precedent. And please don't do that.
Thank you. Questions, committee? Go ahead, Senator Hutchins. Push your button, ma'am.
Mr. Chair, ma'am, did I hear you right when you said you love blood loss?
I know it sounds terrible, but someone has to like to do surgery. Somebody has to like to make that blood loss stop, right? Somebody has to like to do what I do. It seems very strange, but someone has to like to do pap smears. Someone has to like to do kind of the dirty work of making sure that people get taken care of.
Follow up, Mr. Chairman. You mentioned the scalpel. Very important. The scalpel can cut something off.
It does.
If we remove breasts, if we remove penises at the age of 4, 5, 6, 7, up to 18, what can bring those back when they, after 18, decide, oops, I didn't want that done? I was watching a documentary where a young man was mentioning that he was in surgery and he remembers screaming in his mind because he couldn't do it with his mouth. No, no. His penis was cut off and there was nothing they could do to put it back on. So help me understand, because that's what this bill is talking about, mutilating children. How do we put those things, how do we put them back together, Humpty Dumpty, once they've taken the fall?
Doctor, go ahead.
Thank you, Chairman. Thank you, Senator Hutchings. Again, this is not happening in the state of Wyoming. And the most common childhood genital mutilation that happens in the state of Wyoming is actually circumcision, and it's done within 24 hours of life. And that unfortunately is an incredibly common process. And there's probably many of those victims sitting in this room today. And I don't know about the reconstruction of a penis, as I am not a reconstructive plastic surgeon, which is usually a highly specialized topic, but I do know that some of my patients actually do undergo these surgeries, not for gender affirming care, but for medical conditions. They're very involved surgeries that take months, if not years, and they're done in stages. And obviously what comes with those stages is lots of counseling, lots of consults with surgeons, lots of trips and expenses for many medical conditions that require those surgeries to be done. I hope that answers your question.
Mr. Chairman, thank you so much. Are you aware of the Reimer twin experiment? And that's the end of my questions. Thank you.
I apologize. I know of the experiment. I don't know the details. Again, in my field, this is not something that's normally handled by a general gynecologist. It's usually by several subspecialists.
Okay, thank you. Let's take final comments, and then we're going to move on. Go ahead.
Hi, I'm Dr. April Kranz. I've been a pediatrician for 14 years, and I work at the Cheyenne Regional Medical Center. I oppose this bill very strongly, and I think that this room is full of people who care deeply for the well-being of children, and many of us have dedicated our lives to the health and well-being of children, and if this bill goes through, children will be harmed. It's clear in listening to the testimony of the many different people so far today that there is a lot of conflicting information out there about what is the best way to treat these children? Has anyone ever been harmed by this kind of treatment? And I think that it will be important going forward to have more research and to learn more about the best ways to care for these patients. I would really hope that as people who all care about the well-being of children, that we invest ourselves in learning more about how to care best for these children and not to criminalize that care. Criminalizing the provision of gender affirming care will put a stop to that, and it will discourage any further discussion or investigation into the best way to care for these children. And I think that would be a disaster. I do want to, it sounds like there's also been a lot of misunderstanding about the surgical aspect of gender affirming care as opposed to the medical aspect. And I'm most concerned about not criminalizing the medical aspects of this. And I think we've heard from several folks already that these surgeries we're not supporting doing this surgery on children, and that is not the standard of care to do surgery on these children. So I don't think that that's an important aspect of the consideration of this bill, which actually says is talking about criminalizing all medical aspects of transgender care. I also want to plead with you to pay more attention to the testimony that you've heard today that's given by individuals who have personal experience with these patients, with their families, and professional experience with them, as opposed to these to many well-meaning citizens that have strong opinions about this but do not have professional or personal experience in this area. And another thing I would mention is that really refusing to provide the standard of care for these patients with gender dysphoria syndrome is really tantamount to requiring medical neglect of these patients. There are well-established and well-accepted standard diagnostic criteria for gender dysphoria syndrome that have been in use for a lot of time. And I encourage you to not criminalize the science behind this.
15 seconds. Go ahead and wrap up if you would.
So that's all. I think it's complicated. I don't have all the answers. I'm not an expert in this area, but I am a physician. I'm a scientist healer, and I don't think that criminalizing this and passing this bill is going to do good for children.
Thank you very much. Committee, I think we're going to close public testimony. I know there's a lot of people online, et cetera, that want to testify. I would encourage you to send us emails or send emails to the body of the Senate with thoughts, but I think we need to close and I think we need to move on. We're going to be a little bit late as it is, but I don't care. Don't tell the president I said that, please. So let's just go down the road here and let's just give some thoughts on the bill before we actually. No, Senator Scott, if you'd like to come up to the chair. No? Are you sure? Okay. Okay, thank you very much. And that, Mayor, and public testimony is closed. Committee, what's your pleasure?
Move the bill.
Move the bill. We'll give that one to Senator Hutchings. Senator Hutchings, would you like to give your thoughts?
Yes, Mr. Chairman, as I listened to what people said, we got a lot of, I guess, ambiguity. It's like, we don't know. This bill will harm the child instead of helping them. And I see it differently. So those are my quick comments.
Okay, Senator Barlow.
Mr. Chairman, so since there is no definition in the bill of change of the sex, to me, sex is a chromosomal issue. I don't know that anybody's doing chromosomal therapy. So I would argue that this may do nothing, since we are not actually identifying what change the sex is. And that actually came from a physician in another community who said, look, mutilation is on the books, female mutilization is on the books. There are other things, yes, there are hormone therapies, but change the sex is not being identified, and that is a chromosomal thing. What we appear is something else. That's a manifestation of chromosomes. It is not saying so. I don't know that this bill gets to what the bringer would actually say, because it's going to be having to interpret it as what has changed the sex. Thank you, Mr. Chairman.
Senator Dockstader.
Thank you. Appreciate Senator Barlow's note on this. I probably have nothing further to say, but I'll be with the bill.
Senator Bouchard.
Thank you, Mr. Chairman. I mean, we heard things about, I think, WPATH, if that's the right organization. I've done a lot of reading on that subject. Some of the opposition that has talked to these organizations has said there's no new data. There hasn't been a change since 2015. There's actually hospitals that are actually pulling back and changing their procedures to not do the things that we're talking about in this bill. So I think that may be the direction that we need to head in as well. We need to put the brakes on and start looking at data.
Thank you. And I get the final word. My final word is this, is I will be a no on the bill. I think, and this is my view only, of course, is I think the bill is vague. I think it doesn't give specific enough definitions. And I say that in a number of things. Don't think this is a black and white issue. I think this is a very gray issue. And as a medical provider, I'm always uncomfortable with the legislature with very little medical expertise, and I'm certainly not an expert. Don't get me wrong, but we take these things. We've been here 3 weeks now, and to take these things and become experts and create law, that makes me nervous. It makes me nervous not only in this, but more so in these life and death things. For that reason, I will probably be a no. I don't know that we have the expertise. I don't know that this bill is refined enough to do what it intends to do. And I think that we step too far into the medical field. And I think we need to let doctors be doctors and not criminalize people. And that would be my final comment. And with that, I think we're ready for the vote. Let's go ahead and take roll call, please.
Thank you, Mr. Chairman. Senate File 111, Child Abuse, Change of Sex. Senator Barlow.
No.
Senator Bouchard.
Aye.
Senator Dockstader.
Aye.
Senator Hutchings.
Aye.
Chairman Baldwin.
No.
We have 3 ayes and 2 noes.
Senate File 111 has passed the Labor and Health Committee in the Senate. Senator Scott, it's all yours on the floor, sir. Okay. Thank you, everyone that came, and I apologize, but all those who weren't able to testify, please email us, give us your thoughts, and we'll see. And the bill that we didn't hear today will be continued to an indefinite day. I'll decide that.
Indefinite?